Hi, this is Scott Pop for Mobility Minute. We're going to talk about correcting your posture and alignment through using a lacrosse ball. Lacrosse balls are the perfect ball for self-mobilization through your mid-back, into your lower back, and across your hips. What this does in chiropractic is it helps facilitate expansion upward. And so extension of the thoracic cage and extension of the lumbar spine and stretching of the hip rotator muscles allows for this expansion upward and good hip mobility. So what we're going to basically do is use the lacrosse ball from your mid-back all the way down into your lower back and then across into your hips, into this large belly of the gluteal muscle on each side so that it allows the hips to work properly. And what this looks like is that the patient will be laying down. I'm just going to use my little dummy here. Lay them on their back. Put the legs up like this. And so what you're going to do is you're going to have the lacrosse ball. You can start at either end. If you want to start in the gluteal muscle, you'll basically roll up on that ball and you're going to seek out the tender spots all throughout the system. Just the ball itself stretches this deep hip rotator system and gluteal system that gets so tight. Then you're going to put it up in the lower back and you're going to roll up on it there. You're going to move it right up your spine and you can go all the way up into the mid-back. If it's too tender up in here, you don't have to put all of your weight on it. You could just roll a little bit on there, feel the pressure, roll off, move the ball up, roll back on it, move the ball up, roll back on it. It really doesn't work well for the cervical spine. There we use a different type of tool and we use the neck flosser for this tight upper trap system. So this is really good. You can work from the upper thoracic spine down into the glutes, or you can work the other way. You can buy lacrosse balls online. We have them here at our health club just for the purpose of mobilization. Tennis balls don't work very well. Golf balls don't work very well. Softballs can work, but they're a little bit big, especially for the mid-back. You'll never be able to roll fully on that. Baseballs are even a little bit big, so if you can get a lacrosse ball at a sporting goods store, these work the best. This works great, and when you get done, you should feel like you can expand upward better and with less pain than you had originally. Don't overdo it, and only treat areas that are tender. Don't spend a lot of time on areas that are not tender because they don't need to be treated. You can make them sore by over-treating it. And again, don't over-treat by just staying on one spot for 5 minutes. You know, get on there for maybe 10 to 20 seconds and then move up and around that area. So this is Scott Pop from Mobility Minute. Hope you like this video. Thanks.